now. Dax is with us in Hartlepool. Hello, Dax.
Hi there. How you doing, Dalton?
I'm very well, thanks very much. Do you know what tier Hartlepool is in the 1, 2, 3 system?
We're tier 2, which isn't going to affect me at all because I'm locked down anyway. I've been locked down since March. I'm a carer. My brother's dying of a lung disease because he's a miner. Miner meaning he went down a mile into the ground, not a youngster. My background is I trained as a health inspector in the 70s. Mm-hmm. And the first time I actually did contact tracing was about tuberculosis, funnily enough, an ice cream man who was infectious tuberculosis. And I was knocking on doors to see if people had bought ice creams from this guy or kids bought ice creams from the guy. And it was knocking on doors.
So that was an early form of tracing, testing and tracing. It's an early.
That's what public health departments have been doing for 50 years. It was It's part of what our local authorities do. But unfortunately, this government, when it set itself up to be the heroes and wrap itself in the flag and cure coronavirus, and not get the local authorities and the other parties in Parliament involved in a national crisis, they've made a massive mistake.
Yeah, and I think they acknowledge that because they're saying that they will get local authorities involved now, but they didn't from the very beginning, did they? And you're absolutely right. And there was a mixture of private companies doing a lot of this stuff, and they seem to have failed spectacularly.
They ignore the local authorities. Dalton, it's like a child getting a present at Christmas, playing with it until it's broken, and then taking it back to mum to get it fixed. They're going back to the local authorities. That's where the skills are. People on the ground. People on the ground have the skills to knock on the doors to make sure that people know they've been compromised and what they have to do.
But you,
instead of somebody in a back bedroom.
But you, who've been involved with local health. As a member of the council or working on behalf of the council,
public health inspector.
Public health inspector. Forgive me. But you, who's worked with public health, you will know that times have changed since the 70s. You can't go around knocking on doors to see who's been contacting who in the way that you did with regards to that ice cream man. You can't. There frankly aren't the resources, but also, it's not the best use of your time. You do it all digitally now.
Dalton, COVID-19 is a notifiable disease. Okay? Just like malaria, just like dengue fever.
What does that mean, notifiable disease? What do you mean by that?
Notifiable disease. If a person is tested and found to be contracting a certain disease, like dengue fever or Ebola, or COVID-19, the local health inspectors have told of the details. That's the normal process. Yeah. This government set up a different process and introduced organizations to do it through a contact center. Now, all that's going to happen now, hopefully, is that the information is made available into the local authorities who can run teams knocking on doors. In Germany, they have done it in exactly that way. Their test, track, and trace gets the central data, delivers it to the local authority, and they've got teams of 5 dedicated, 5 people per 25,000 population. And that's how they've managed this.
Yeah, well, we've always got to learn from the Germans. For one reason or another, they just seem to, do these kind of things better than us. I don't know what the answer is to that. But Dax, on that wider question that I asked about whether the government have got they failed in many respects, and they'll accept their failings. They are accepting their failings, which is quite something in any case. But the wider question of whether they're getting the balance right, essentially, between this sort of need to make sure that the economy doesn't collapse entirely and the need to save lives. Are they getting that right for you?
They've tried, but they've not done a perfect job. And being fair, they're working hard. And if you notice, when questions are asked about failings in the system, what our MPs and leaders say is we're working very hard. We're working all hours that God sends to fix this. But they're not actually answering the question of why things are not going right. And just good organization and using all the resources of the country should be the method that we use. By the way, the Germans are not teaching us about this. We taught the Germans about public health. We if you look at our history, cholera was rife in our country, and that was delivered and sorted out by the local authorities, not central government. Manchester, Birmingham, they were the key sites where cholera was actually dealt with through public health.
Dax, it's been a pleasure speaking to you. Thank you very much. I really appreciate it. And thanks for the history on the German thing as well. I hope they're giving us props where we deserve it. Dax in Hartlepool, as you could hear, felt that the government haven't done things the right way in respect to public health officials going around and notifying people door to door or otherwise as to what's going on. The government